can be affected by this disease. The global prevalence of the disease ranges from 3 to 10%, but we do know that in the developed countries, the prevalence rate is a bit lower. We talk about 2 to 6%, and then generally higher in the developing countries like Ghana, where up to about 14% have been described in some studies and in some countries. I brought this slide for us to just appreciate. Kindly focus on the first two rows, where hypertensive disorders and hemorrhage conditions in pregnant women are compared. Generally, I have to underscore the fact that hemorrhage and hypertension are the two leading causes of maternal mortality or maternal death in our part of the world. These are the two leading causes. And over the years, it looked like the impact of hemorrhage and hypertension has been changing. This is some data collected from our premier hospital, Kolebu Teaching Hospital. In 1963 to 1967, you see that hemorrhage contributed about 65% of maternal death in that hospital, while hypertension contributed only 15.4%. But over the years, in 2002, whilst hemorrhage contributed 19.6%, hypertension contributed 28.4%. And recently, from data we collected at RAGE, we realized that whilst hemorrhage contributed about 22.2%, hypertension contributed 41.7%. So clearly, hypertension in pregnancy, or what we call preeclampsia, increasingly is becoming a leading cause of death, especially in the bigger institutions. Even though one can still say that nationally, it is still hemorrhage, which is the leading cause of death. So what then are the causes of this condition that is much talked about? What are the causes? And I'm afraid to disappoint you to say that as per the current scientific knowledge, the exact cause of preeclampsia is still not known for sure. We, however, believe that it's associated with abnormal formation of the placenta, which is also called the afterbirth. This situation leads to the situation of abnormal production of some of the important hormones in pregnancy and certain chemicals, which eventually lead to changes which we know are associated with the entity. In some cases, genetic factors have been suspected. What then are the risk factors? As I said earlier on, even though we do not know the exact causes, we do know the risk factors. The first among them is the extremes of age. When a woman is less than 18 years and embark on pregnancy, a risk of developing preeclampsia has been found to be high. The same way, when a woman is more than 40 years of age and embarks on pregnancy, her risk of preeclampsia is also high. We also talk about premi-gravid or women who are carrying their first pregnancy. So even if you are 25 years or 30 years and you are carrying your first pregnancy, your risk is high. We also do know that the African race is a race that is known to have a higher risk of preeclampsia. Obesity is another consideration, it's another risk factor. Multiple gestation for women who are carrying either twins or triplets or quadruplets, their risk of developing preeclampsia, we know, is also higher than women who are carrying one pregnancy. If you already have hypertension, if your blood pressure is high and you have been taking some medication, blood pressure medications, before you embark on pregnancy, your risk of developing preeclampsia is higher. Or if you are known to already have some kidney disease before embarking on pregnancy, your risk of developing this condition is also higher. If you have had this condition in a previous pregnancy, let's say your first or second pregnancy, your blood pressure went up and you were diagnosed with preeclampsia, then in the index pregnancy, your risk of developing preeclampsia is also higher. Family history is also another important consideration, especially history in your in mothers and sisters. If your sister had preeclampsia in pregnancy, then there is a chance that when you get pregnant, you may also develop preeclampsia. Others include diabetes, for example, first pregnancy for a new husband. The explanation of this is that even if you have 2 or 3 children already, and you maybe get separated or divorced, and you marry a new husband and you are carrying your first pregnancy for that husband, your risk of developing preeclampsia goes up. It's like a first pregnancy. It's like the risk of somebody who is carrying a first pregnancy. And this has been confirmed by research. Other factors include poor nutrition, diet that is lacking in folic acid, calcium, or magnesium have all been implicated. These are some of the risk factors. So as you can see, this is an extensive list of risk factors. So a little classification. Pregnancy-induced hypertension is the first, which is the commonest that we normally refer to, pregnancy-induced hypertension, which means that the woman was not hypertensive before she got pregnant, but because of the pregnancy, hypertension has developed. Then when such a person who has pregnancy-induced hypertension also develop a complication of her kidney, which lead to the appearance of proteins in her urine, then we call that preeclampsia. You remember, for those of you who have been pregnant, you remember anytime you go for your antenatal checkup, the midwives always check your urine at any visit. One of the things that they are looking for is proteins in your urine. So when you have pregnancy-induced hypertension and proteinuria, we say that you have preeclampsia. And preeclampsia is a terminology that we want everybody now to know. It should now become a watchword that everybody should know that there is a condition in pregnant women which is called preeclampsia. Then we talk about pre-existing hypertension in pregnancy. So these people have not developed preeclampsia, but they are already severely hypertensive even before they embark on pregnancy. Then we have pre-existing hypertension with superimposed preeclampsia. So you already have hypertension before you embark on pregnancy, and then during pregnancy, you develop other factors or other parameters which make the clinician to say that even though you are already hypertensive, you are now developing this condition that we call preeclampsia on top of the hypertension. Then we also have another category which we call imminent eclampsia. In this case, the woman is about to, eclampsia is a terminology that we use to the occurrence of fit in women who have preeclampsia. If you fit, then we say that you have eclampsia. But if you haven't fitted yet, but you have signs and symptoms, which shows that you might fit any moment from now unless something is done, then we say that you have imminent eclampsia. So it means that the fit is imminent. Then the last type is what we call HELLP syndrome. This is a combination of complications that include certain elements in your blood, certain elements of the liver, and so on and so forth that are put together that we call the HELLP syndrome. So, ladies and gentlemen, these are the classifications of the disease. But I don't want you to worry yourself by trying to memorize all these things. For me, the single and the most important of this list is preeclampsia. That is the cardinal terminology that we should all remember. So what then are the complications? As I said earlier on, virtually every organ of the body can be affected by this condition. So talk about eclampsia, which I've already referred to, which means fitting. So when somebody with preeclampsia develop fitting or begin to fit, then we say that the person has developed eclampsia. Then we also talk about stroke. Sometimes the blood pressures can become so high that the person can have stroke. Then we have what we call edema. Edema actually means that the body is retaining excess fluid. So you see that that particular part of the body becomes swollen. So you see some pregnant women whose faces may be swollen, or sometimes their entire body is swollen. When you have a situation where the entire body is swollen, then we call it generalized edema. If the swelling involves only the brain, that is, if maybe through some tests we show that the brain is swollen, we call that cerebral edema. Sometimes even the eyes can be affected. Even the brain, the part of the brain that controls vision can be affected, or the part of the eye that controls vision can be affected, and it can lead to either temporary blindness or permanent blindness. Then we also talk about edema of the windpipe, edema of the lungs, which we call pulmonary edema. Your heart can fail. If the blood pressures become so high, the heart can even fail. Then we also talk about premature separation of the placenta. We all know that first the baby must be delivered. That is the normal physiological process, what God has put in place. is that when a woman is pregnant and at the end of the 9 months, the baby is delivered, and then the womb contracts before the placenta is separated or the afterbirth. But in this category of people, sometimes the placenta can separate prematurely, even whilst the baby is in the womb. And this is an emergency, it's associated with excessive bleeding, and the baby can die. And the baby also dies almost immediately because the placenta is a source of nutrient and oxygen to the baby. Then your liver can also be affected, the kidney can also fail. So as you can see, every single organ, so many different organs of the mother's body can be affected. When we look at the baby may not grow well because the placenta itself has not formed well. That is the theory that we believe. The baby may therefore die in the womb, or during delivery, the baby may die during delivery and be born as stillbirth. Sometimes the baby may be alive, but the baby's weight may be overly so low, far below what is expected for the gestational age for which the baby is delivered. Just to explain, let's say if the baby is carried up to 9 months and we expect the baby's weight to about 3 kilos, the baby may be born with a weight of about 1.5 kilos. And so obviously that will be a baby whose weight is far below what is expected. Sometimes because of the conditions of the mother, doctors may attempt to deliver the baby prematurely in order to save the life of the mother. In that case, the baby experiences what we call prematurity. So this condition is one condition that leads to delivery of a lot of premature babies, simply to save the life of the mother. And because of all these complications that I've mentioned, there is a high rate of fetal loss or a high rate of newborn loss. So babies whose weights are too low, babies who are very premature, all these babies, they have a higher risk of dying in the early neonatal period. Then what are the long-term complications? Long-term complications. Ladies and gentlemen, the problem with preeclampsia does not stop with the delivery of the woman and after the 6 weeks, as we normally said in the past. We now know that there are certain long-term complications that can also affect the pregnant woman, that can also affect the woman because she has had preeclampsia in the past. Some of these long-term complications are chronic hypertension. So if you have had preeclampsia, severe form of preeclampsia, know that you are at risk of developing hypertension. So it means that you have to continue to monitor your blood pressure months and years after you have been delivered. Cardiovascular diseases like heart diseases and vascular diseases. You could be at risk of developing stroke. Blood clot disorders can also happen. Blood clot, that we don't know that the blood in our body must remain in a fluid condition so that it can flow. Sometimes during certain complications, blood may clot in certain parts of the body. And sometimes the clots are dislodged and it goes to the lungs to cause further complications. Diseases of the thyroid has also been mentioned. Diabetes, women who have preeclampsia are also at risk of developing type 2 diabetes in the future, kidney diseases, and memory disorders. These are just by a few of the long-term complications. And so therefore, the advice is that if you have had preeclampsia, continue to monitor yourself, even years after you have been delivered. I have some 2 case studies that I want to share with you, then I bring my presentation to an end. First of all, I want to talk about case number 1, Madam MM. Madam MM is a 24-year-old woman. She booked for antenatal care at the polyclinic. Her blood pressure was normal throughout the pregnancy, but at 36 weeks, when she attended in the morning, as per the schedule, everything was found to be fine, including even her blood pressure, according to the antenatal record book. Back at home that night, she started experiencing severe headaches. The husband gave her paracetamol, and they decided that they would wait till the morning to report back to the polyclinic. In the morning, they reported back to the polyclinic, where her blood pressure was found to be very high, 200/120, with proteins in her urine. Ladies and gentlemen, just the day before, when they went to the same clinic, her blood pressure was found to be normal and everything was apparently normal. Just within 24 hours, when they went back, when she had headaches and they went back, it was found that her blood pressure was 200/120. She was then referred to the Rich Hospital. They didn't get an ambulance, and so they were dispatched in a taxi. Before they could get to Ridge, the woman had started feeding, and the placenta also prematurely separated, leading to the death of the baby. Her own life hung delicately in the balance. Fortunately, ladies and gentlemen, this woman survived. Early reporting to the hospital could have averted this disaster. If only when she started having the headaches in the house in the night, she took a taxi and reported to the hospital, and she's referred to the earlier hospital. We could have saved about 12 hours of her time, and the worst complications of feeding or eclampsia wouldn't have happened. So the lesson in this case study is the early reporting to the hospital whenever you experience a complication is one of them, or you experience any severe sign in pregnancy. Case number 2, Madam J.M., 34-year-old. She was referred to Ridge Hospital at 30 weeks of pregnancy with severe preeclampsia. She was admitted and initially managed conservatively to control the blood pressure, and then also to give her some medication so that to make the baby in a better position to be delivered. Barely on the 3rd day of admission, she and the husband requested for her to be discharged home with the reason that they needed to care for the other children in the house. And this is a common excuse that we get. Sometimes when we try to admit women to the hospital because of severe preeclampsia, they tell us sometimes they want to refuse admission, and they tell us that they have other little children in the house that they want to look after. The team doctors declined to the request and requested them and counseled them that it was unsafe to go home with the condition. But they wrote a letter to the hospital for discharge against medical advice, and they forcefully left the ward. Much as the staff, the midwives, and the doctors tried to restrain them, they packed their things and left the ward. 2 weeks after they left to the house, the woman was rushed back unconscious and in severe condition. She suffered injury to her kidney from the disease. The baby did not also survive, and she herself now have an impaired kidney. Ladies and gentlemen, this is a true story, a case that we have received at the Greater Accra Regional Hospital. There are several other similar cases where patients fail to heed to the advice of the medical team. Some of them declining, they say, cesarean section. Currently, we even have one patient on the ward because her blood pressure was so high and she was not yet 9 months. The doctor decided that they would deliver her by cesarean section and send the baby to NICU, but they refused. They refused. And because of that, she suffered other complications, and she is currently in intensive care unit because they did not listen to the advices of the doctors. I'm almost done. Summary and conclusions of my presentation. So some of the things that I have been talking about over the past few minutes include the fact that preeclampsia remains a serious disease that affects pregnant women in Ghana and other parts of the world. And as such, we all must take this condition very seriously. It's a significant cause of maternal death. It can also cause damage to some major and important organs of the body. Though the cause is not known for certain, we know the risk factors, which are listed above. Survivors should still maintain strict medical checkup regimes because of the long-term consequences of this condition, some of which I have shared with you earlier on. Sometimes the onset of the disease will be rapid. And so every symptom or sign in pregnancy should be reported to the hospital, or at least to the attending doctor or midwife, be it through phone calls. So if you call your midwife that, oh, even though I came to clinic today, I have severe headache, your midwife may advise you to come back immediately. It is also important for pregnant women and the public to collaborate closely with medical teams in order to achieve better outcomes. If only the advices given by the medical teams are adhered to, outcomes will be better. Thank you so very much for listening. This brings me to the end of my presentation. Thank you.
Thank you very much, Dr. Sofenyo, for such a wonderful presentation. I already have a lot of questions, but before then, we will now go to Dr. Helena Kaba to give us the second presentation, and then we will have an interactive session. Dr. Kaba, if you can kindly share your screen and commence your presentation. Thank you.
Okay, so good afternoon, everybody, and it's a great pleasure to share knowledge on this very important thing that Dr. Shofenyo has talked about. Hypertension, preeclampsia is something that is very, very dear to me. All these are talk, all these are all the things that Dr. Shofenyo has talked about. It's just for one thing that women are dying in pregnancy, and it shouldn't be so. It shouldn't be so at all. When you go for conferences, you meet doctors who have taught generations of house officers, generations of medical students, and they have not seen as many women dying in pregnancy as we see in sub-Saharan Africa and Ghana for that matter. So it means that there are so many things we can do to reduce the number of women who die during pregnancy. It is not acceptable for a woman to die. We are having this series because we want to empower. We feel that you as a patient, you out there, you as a relative of a patient, you are an important stakeholder who can help frontline workers to make our story different. Making our women live does not just depend on the healthcare workers. No, it is an important thing that we all have to play a role. So you as a patient, you as a relative, you as a cousin, whoever you are, you can spread the message that there's so much we can do to let our women live. As my boss, Dr. Shofenyo, has mentioned already, hypertension in pregnancy, preeclampsia, is one of our leading causes of maternal death. When we say women dying in pregnancy, so that is why we want to empower people. So this afternoon, now I'm going to talk about the signs, the symptoms, and the myths of preeclampsia. When we say symptoms are what you as a patient, when you have a disease, you will complain to a frontline worker about. And then signs are the things that we as doctors or nurses will be able to pick up on you to show that yes, you have the disease. And the myths are all the stories that you have heard about preeclampsia that we want to demystify this afternoon, okay? So I will also start, Dr. Shofenyo has told you a lot of stories. So I would also start with a story. And this is also a true story. One day I went to work, when I was working at Lekma Hospital, I closed work around 2 o'clock. I went home, I parked my car in front of my gate. I said, well, let me look at my electricity meter to see how much electricity I have. Then I saw 2 boys, one carrying this Ghana must go bag on his head. In fact, they looked very kind of dirty. Their clothes were dirty. And if I didn't really have to ask them any question, but they actually walked through my garden. I have this flower garden in front of my house. They walked through. So at that point I said, oh, little boys, why did you walk through the garden? But what are you actually carrying on your head? And one of them said, Madam, from morning we haven't eaten. And our mother sells orange at the station. So we are on our way to go and find out if she can get some food for us. And I said, so where have you been since morning? They said, we've been with our daddy. Our daddy is a carpenter. But he said there is no food. So 2 o'clock, we said, well, let's go to the station. If we find our mother, by all means, our mother would get us some food. So in fact, to cut a long story short, I had this pack I had brought from work, rice and some chicken, and I gave it to them, and they left. So but as they were going, I just felt that probably the Holy Spirit spoke to me that no, give them more than that. So I ran after them. Can you believe that I went to find them seated on the ground, bare ground on the street, eating the food. So you see that our mothers have to live. No woman should die during pregnancy. We need our women to live because these are boys who say no. Once they see their mom, they know that no matter what happens, their mother will look for food for them. So anything we can do to let our mothers live, please join us in this our fight. So that is why we are empowering you through education. So what are the signs and symptoms? When we say signs and symptoms, I've explained already that what the patient would feel, for the patient to know that I have preeclampsia, and the signs are what we as healthcare workers would pick up. The first thing I want you to know is that you may not have any symptom at all, you may not have any sign at all, but you have preeclampsia. It is very important you take note of this. that you may be walking around, you just go to the hospital and your blood pressure is checked and you are told that your blood pressure is high, so you have preeclampsia, you have hypertension. So please take note. Don't argue and say, oh, I'm fine. No, no, no. So the first symptom that I want you to take note of is that you may have hypertension, you may have preeclampsia, but you may be feeling very well and walking around. The other thing is for you to say that, yes, I have blood pressure issue. It means that your blood pressure should be high. And we are looking at a figure of 140/90. You may not be a medical person, but just put that in your mind. That we said the blood pressure of 140/90 and above is hypertension in pregnancy. So let us be very interested in our blood pressure. So the symptom, I said you may not have any symptom, but if they measure your blood pressure and by protocol or by our standards, any pregnant woman who enters any of our facilities, be it private facility, government facility, the first thing that is done is your blood pressure is checked. It is mandatory. So if you enter any facility as a pregnant woman and nobody checks your blood pressure, please know that we are giving you this information to empower you to humbly request that your blood pressure should be checked. And let's show an interest in our blood pressure. As women, let's not just be interested in how we look or the wigs we buy. No, let's know that if you are pregnant, be interested in what your blood pressure is. And if you are a partner, you are related to a pregnant woman, if the woman goes to any facility and comes back, ask her, what was your blood pressure? Okay. Another symptom is headaches. If you have headaches, severe headaches, especially after 20 weeks of pregnancy, it is when we say 20 weeks. So let's say roughly about 5 months of pregnancy. If you have severe headaches that are not abating, it could be a sign and a symptom of hypertension and preeclampsia. I'll just share a story, and this is also a true story. One lady, very young lady, who had, Dr. Shofenyo mentioned that one of the complications of preeclampsia is that you can have a fit. You can have a fit like an epileptic patient. So this woman in her first pregnancy, she had hypertension and had a fit. But by God's grace, she survived. Went home, she was fine. She got pregnant a second time. And she went to visit her stepmother who lived somewhere in Teshi. True story, she started having severe headaches. So what did they do? They gave her paracetamol and put her to bed. They gave her 2 paracetamol tablets, put her to bed and covered her. By next morning, she was found to be having a fit, having an epileptic attack. Rushed to the hospital. Before anything could be done for her, she was dead. This is a true story. So headaches in pregnancy, especially after the first 20 weeks or the first 5 months of pregnancy, can be hypertension or preeclampsia until proven otherwise. Another thing we want you to know is when you see light flashes. So you are pregnant and then suddenly you see that there are some light flashing, like you just see light flashing in your eyes. It could also be a sign and a symptom of hypertension and preeclampsia. Another thing, you have blurred vision. You are pregnant, you are going about your business, suddenly you notice that your vision is blurred. It's like it's as if like your vision is hazy, as if the whole place is dark around you. Please take note that it can be a sign and a symptom of hypertension and preeclampsia. And the severe nausea. Nausea in early pregnancy is kind of to be expected, sort of. But if you have intense nausea that is so intense and it is not stopping, and especially after 20 weeks of pregnancy, you shouldn't expect to be having nausea as you were having in early pregnancy. So if you start having something like that, it could be a warning to you that you are having hypertension or you are having preeclampsia. And then vomiting. Then again, vomiting is one of the symptoms in early pregnancy. But if you are vomiting persistently, it is not stopping, Please don't assume that, oh, it is part of the early morning sickness. It could mean that you are developing hypertension, you are developing preeclampsia. Please go for care. And especially if you start vomiting after the 20 weeks of pregnancy, just know that it could be a sign and a symptom of hypertension and preeclampsia. There are other things too. If you have pain in the upper parts of your stomach, when I say abdomen, and people would, maybe to the lay person, you say stomach. So if you have pain in the upper parts of your stomach, please, and you are pregnant, it could be a sign and a symptom of hypertension and preeclampsia. One story, and this is also a true story, there was a patient, a very young patient, about 22-year-old, went to one of our facilities and she was pregnant. She complained of pain in the upper part of her stomach. Her blood pressure was just slightly elevated, or her blood pressure was a bit high. She was given some medicine. She was asked to stay for observation. She said, no. She said, well, I just walked into the hospital. I have just pain in the upper part of my stomach. Why would you have to admit me? No amount of talking will let her stay. And this is a true story. She left the hospital. Within 2 days, she was found fitting and she was taken back to that same hospital, but she died upon arrival. So you see that these signs and symptoms are things that you may think they are not anything alarming, but we are just giving you all this information that if you are pregnant and you experience pain in the upper part of the abdomen, especially if you wait maybe for it, you realize this pain is intense, it's not stopping, please immediately go to any of the health facilities. Dr. Shofenyo talked about fits or epileptic attacks. When I say epileptic attacks, does not necessarily mean you have epilepsy, but I'm just using to describe that if you see a pregnant woman who is having a fit or having something that you would describe as epilepsy, in pregnancy, we don't call it epilepsy, we call it eclampsia. It is called eclampsia, and it is the end point of hypertension, and this can be prevented. Nobody should get eclampsia. This can be prevented because it is the end point of hypertension, it is the end point of preeclampsia. Another thing too, Dr. Shofenyo has mentioned already, he mentioned the risk factors. So if you have any of the risk factors, or even if you don't have any of the risk factors and you are pregnant, just take note that you can have hypertension, you can have preeclampsia. So if you experience any of the things I've talked about, please, you rush for care. And anybody who has suffered hypertension before in any of the previous pregnancies, as my professor, Prof. Pakume of Family Health will say, he said, women, we like habits. Women repeat themselves. So once you've had hypertension or preeclampsia in the past, and you are pregnant, just take note, even that past history alone is a sign and a symptom. So if you have any of the things I've mentioned before, immediately you go for care. And sign and symptom of the late stage or an end point of hypertension and preeclampsia is unconsciousness or coma. You find a pregnant woman in coma, it is likely that that person may be experiencing the end point of hypertension in pregnancy and preeclampsia. Other things that Dr. Shofenyo talked about, generalized swelling. You find a woman who is swelling all over. We call it an asaka in medicine. The woman is swelling all over. Or maybe you are wearing your wedding ring. Your wedding rings become suddenly very tight. It is also a symptom of hypertension in pregnancy or preeclampsia. So remember, swelling all over, you look all swollen, especially you wake up in the morning and your face is swollen. It can be a sign and a symptom of hypertension and preeclampsia. If your wedding rings become very tight, it can be a sign of hypertension or preeclampsia. Bleeding in pregnancy can be a sign. Dr. Shofenyo mentioned earlier on about something we call abruption, where the placenta moves away from the wall of the womb. When you have that, you bleed. It is hypertension. That's one of the things that can cause that is hypertension. So if you see bleeding, you are pregnant and you see bleeding, it could even be a sign and a symptom of hypertension or preeclampsia. So all these things that we've talked about, what do they mean? It is a sign of impending danger. When you're having severe headaches, you see flashes of light, your vision is blurred, you have nausea, you have vomiting, you have pain in the upper part of the stomach. All these things warn you that hypertension and preeclampsia have started. But the end points are the complications. The end points are the treating. The end points are the coma and the unconsciousness. You don't need to get to that point. If you are home and you start having these things, it means that you have to run to hospital. Even if it's 2 a.m., don't say that it is night, I'll wait till morning. You may never ever get to see the morning. So please take note that all these things warn you of impending danger. If you are home, it means that run to hospital, even if it's midnight, even if it's 2 a.m., do not wait for the morning. Do not say that, oh, I went to the clinic yesterday, my next visit is in a week, I'll go and report when for my next visit. No, it is very important you go to hospital. And we are giving you all this information to also empower you that when you get to the hospital and you're having any of these symptoms, and you get there, just in case you find any healthcare worker who says, oh, take paracetamol and go home. No, just you should be able to ensure that you have been given appropriate care. So that's why we are saying if you have any of these things, it could be hypertension, it could be preeclampsia. So when you get to the hospital, please ensure that you have been given appropriate care. We are, by this information, we are empowering you. You may not be a health worker, but we are empowering you that you are an important stakeholder in your own care. So you should be empowered enough to respectfully tell the healthcare worker that you are afraid because you think this could be preeclampsia or hypertension. So you would want that to be carefully considered, okay? Some of the signs and symptoms too, like I said, they are the late stages. They are kind of the end points. When the damage has occurred already, then you would see them. Hypertension and preeclampsia, it's a very serious disease of pregnancy. Once a woman gets that, it's as if a knife has been taken and the knife just destroys every part of the body. Preeclampsia can, as an end point, it can even cause blindness and visual disturbances. It can go to the brain, disturb the brain, and this can result in blindness and visual impairment. It can cause a stroke. In my practice, I remember I saw one lady, that was her first pregnancy. She went home with a stroke. She was sitting in a wheelchair. And it was a very sad story because as soon as she had a stroke, her husband ran away. The husband said, oh, but even the young girls in the neighborhood, they go and have babies and they come back and they are wearing their white and doing their GMO or having their outdooring. And you are married, you go and have a baby and you are sitting in a wheelchair. The husband left her. True story, the husband ran away. She went home in a wheelchair. And this is just because of hypertension. Dr. Shifeno has mentioned kidney damage. Hypertension and preeclampsia is very notorious for damaging the kidneys. What do the kidneys do? The kidneys are the Zoom lion, or they are the waste system. They handle the waste in our body. All the waste in our body, if you take drugs, the extra drugs are cleared by the kidneys. If you take food, the extra food they are cleared by the food tract and the kidneys. So if you damage the kidney, you can imagine when Zoom Lion or all the waste system, if they should go on strike and say we won't do any work, you can imagine the whole Ghana will smell, there will be rubbish all over. I mean, it will be terrible. So you can imagine when the disease destroys the Zoom Lion of the body and the waste system is fault. So it means that there will be a pileup of all the waste in the body, and this is kidney damage. You cannot survive if something serious is not done for you. And if the liver is damaged, you will see a pregnant woman who has severe jaundice. Jaundice is yellowing of the eyes, and that is a sign and symptom. And this is one of the late or the end points of hypertension and preeclampsia. I keep stressing this point that when it comes to hypertension, there is nothing, as Dr. Shofenyo said, unfortunately, despite all the work and the money we've pushed into this disease, the cause per se has not been established. So you really cannot prevent you developing hypertension and preeclampsia, but you can prevent the end points. You can prevent the damage like the blindness, you can prevent the strokes, you can prevent the kidney damage, you can prevent the liver damage by paying attention and running for help and demanding respectfully for quality care. Okay, so now let's look at some of the myths. Time and time again, you see patients who you say, oh, madam, you have hypertension, you want to explain, and the person says that, no, I mean, I want to go home, I'll reduce my salt, I'll exercise, I'll do all this. One of the myths that we want to change, if that is your mindset, please let's take this message home. Let's tell all our friends that hypertension in pregnancy is completely different from hypertension outside pregnancy. Outside pregnancy, we talk about salt intake and all that. And when it comes to hypertension in pregnancy, the cause has not been established. Even though we know there has been theories that it's a disease that is happening at the level of the placenta and all that, but the cause has not been established. So it's not something that is from salt or from your lifestyle or anything. So it is very important that you listen to what your doctor says. Don't say, I'm going home, I'll reduce my salt intake. No. Another myth that this afternoon I want to demystify for you is that no symptoms. See, the fact that you are fine and you are walking around does not mean that you are hypertension free or you are preeclampsia free. Not at all. You may be walking around, but your blood pressure is high. You may not have anything, but once your doctor says you have preeclampsia, remember that we said preeclampsia is just hypertension plus we finding proteins in your urine. We may find proteins in your urine, but you don't have any problem. But once we see your blood pressure is up and we find proteins in your urine, we said it's preeclampsia. So please, the fact that you don't have anything worrying you does not mean that you don't have preeclampsia, you don't have hypertension. Please take that out of your mind. And as Dr. Chopinot has mentioned in his stories, and from there's few stories that I have also shared with you, things can change within seconds. Hypertension in pregnancy and preeclampsia, I mean, things can just change so drastically that, I mean, you would be amazed. The patient walks into your consulting room, very fine. You have to literally beg the patient to admit the patient, and the next minute, the patient is fitting before your eyes. But I'm stressing the point that once you come in early, we can prevent the fitting. There are drugs we can give to prevent the fitting. There are things that we can do so that you don't get the end point. Time and time again, we hear patients saying that God will make sure that you are fine. Of course, we depend entirely on God. As healthcare workers, if we say we just depend on the knowledge that our founding fathers gave us in medical school or in nursing school, we are lying. Now, lie. We depend entirely on God, but God has given us wisdom. So yes, God will make sure you are fine, but it is very important that you, in as much as God will make sure you are fine, you still need medical attention. You need proper management in order to be fine. God plays a role, but God has also given us wisdom. So just remember that preeclampsia, yes, God plays a major role for you to be fine, but you also, in addition to that, I'm sure God expects that you would also listen to what your doctors and your nurses say you should do, okay? And then remember that healthcare workers are human. In fact, there has statistics, research has shown that medical errors occur. Medical errors are kind of, it's almost everywhere, even in the most developed of places, you can have medical errors. So that is why we are empowering you with this knowledge that we want to tell you that there's a disease that is killing our women. If we do something, we can prevent our women from getting to the end point. And you are an important stakeholder. And when you go to the healthcare facility, don't put it in your mind that healthcare workers are infallible. So if you go and you're having severe headaches, you're having flashes of light, and per this discussion, we are telling you that it could be a sign of hypertension or preeclampsia. Don't say that, oh, I got there, the healthcare worker did not check my blood pressure and said I was fine, get paracetamol and go home. No, you should be able to know that healthcare workers can also make mistakes. So what you do is, I mean, we are empowering you that if you go to any healthcare facility and you suspect that you are developing, you have preeclampsia or you have hypertension, and you think that the management was glossed over, you think that, oh, they just checked your blood pressure, nobody told you your blood pressure, you should show an interest. If your blood pressure is more than 140/90 and you are told that nothing is wrong, you go home. No, you should be able to respectfully, as Koewa would always say, respectfully. You should be able to respectfully say that no, please pay attention to preeclampsia and hypertension. If you are not satisfied with care there, you can seek care in another place, because we said hypertension is a serious thing and the end point can't be prevented. What are some of the do's that per this our discussion we want you to do? We said family planning is very, very important. Family planning is our primary prevention of maternal death. It is our primary prevention of hypertension in pregnancy. That if you, for a reason, you don't want to have a child, you should be able to do family planning so you don't get pregnant. If you don't get pregnant, you not develop hypertension in pregnancy. We said be interested in your blood pressure. It is very important. And be empowered to respectfully demand appropriate care and be compliant with admission, medication, and management. Okay, so don't refuse admission, don't delay care, don't refuse management plan, don't refuse medication. So in conclusion, we have talked about the symptoms, the signs and symptoms. We said that hypertension in pregnancy is one of our leading causes of women dying in pregnancy. The fact that you are in Ghana does not mean that you should die when you are going to have a child, because in other places, the women live and we can live. And it is not only the healthcare workers who can make the women live. We are empowering you by this discussion to know the symptoms and the signs of one of the leading cause of women dying in pregnancy. And that is hypertension. We said, know that if your blood pressure goes above 140/90, it means that you have hypertension. You cannot do anything to prevent that, but you can prevent yourself from dying. You can prevent a relative from dying. So what are the things that would warn you? A blood pressure more than 140/90, you may be walking around, you may not have any problem, but you could still have hypertension and preeclampsia. If you have severe headaches, you have flashes of light, you have blurred vision, you have nausea, you have vomiting, you have pain in the upper part of your stomach, if you are swollen all over, if your wedding rings or you are wearing any ring and the rings are tight on your fingers, and if you see bleeding, it could be signs and symptoms of hypertension. So we said be empowered and seek care and humbly or respectfully ask for appropriate care, and prevention of death in hypertension is very possible. Thanks so much for your attention.
Thank you very much, Dr. Akaba, for a wonderful presentation. You couldn't have done it any better, breaking it down to our language and helping us appreciate the seriousness of this condition. Thank you to Dr. Shofenyo. Right now, we'll go to the question and answer session. If you have any question at all, kindly raise your hand. If not, you can also post in the chat box if you don't want to raise your hand, but let us get interactive. It is very necessary that we discuss this condition and appreciate the seriousness of it. If you also have a story to share as a survivor, you can also do so briefly and we will listen to you. But I have a quick question though. So I'm a 3-time survivor of preeclampsia, eclampsia, and there's something called HELLP syndrome. In the presentation, I'm not sure I heard much about that. Can Dr. Shofenyo or Dr. Akaba, can you educate us on what the so-called HELLP syndrome is also about? Thank you very much.
Oh, Hello, can you hear me?
Yes, we can hear you, Dr. Shofenyo. Please go ahead.
Okay, thank you very much. I actually explained it a little, but I was afraid not to go into too much detail because of the kind of audience that we are dealing with. But as you have brought it back, I will explain. Actually, HELLP syndrome is an acronym of the first two letters of HELLP syndrome. The first two letters refer to, the first letter H refers to hemolysis, which means breakdown of red blood cells. And it's one of the complications. It's a particular group of complications, and it's that the first H refers to hemolysis. The first EL, the next two letters EL, means elevated liver enzymes. That is, this condition happens when the liver is damaged in one way or the other. Certain enzymes are released into the system. And so your blood, when your blood is taken and sent to the lab, certain of the liver enzymes are found to be high. That is what we call elevated liver enzymes. And the last two letters, LP, means low platelets. Low platelets, platelets are one of the most important elements of the blood, and they help blood to clot. And they have very important functions in the body, and one of which is helping the blood to clot. So when you have an aggregation of these three different complications, that is hemolysis, that is the red blood cells are breaking down, then you have elevated liver enzyme, which means that there is some kind of damage to the liver, and then you have low platelets, which means that the ability of the platelets have been destroyed. Then we call it HELLP syndrome. And such a complication is usually associated with excessive bleeding. Most of the time, that is what they come with. You see the woman coming with excessive bleeding, and the woman may also be jaundice. So this is what we call HELLP syndrome.
Okay. Thank you very much for the answer to that. And another question that I have before I give it over to a local info, because it sounds very heavy. You know, some participants may not relate to it. What about those who are very local? Is there really a local name for preeclampsia or hypertension in pregnancy, really?
That is an interesting question. Let's see what Dr. Kaba will say.
Okay, I think that.
Yourself, what do you suggest?
Okay.
Host, okay. Are you there?
Okay. So, well, I think that because outside pregnancy, they say moja brusu for entry is not to say all the other languages are important, but not to say that because tree is a language that lots of people communicating. So when you say moja brusu, it's like outside pregnancy, that's how we describe hypertension. So I think that probably in pregnancy, you can say that, oh, mami wunyim, but moja brusu, something. That's how I can. That's the way I can come down. I am done. So maybe in Ghana, I'll say, oh, here musushi, oh, BPA. So I think there's really no term that I can easily remember, but it's more like you describe it and try to say it as we mentioned hypertension outside pregnancy in the local dialect. Oh, Dr. Shroff, what do you think?
I think you've done your best. I think that the move, therefore, should be for us to work together from the linguistic point of view, to work together, to begin to find good local terminologies to describe some of these conditions in medicine. So this challenge that Kwewa has posed, Kwewa will help us to find a good descriptive language to aptly explain this condition to our women. Thank you. Kwewa, you have the job.
Hanif, you can go ahead and ask a question. Okay, looks like Hanifa is available, but there's some. Oh, okay, hello. Hanifa, yes, go ahead. Hello, we can hear you.
Good evening. Please, Dr. Shroff spoke about blood pressure. So my question to him is, what is the normal blood pressure for a pregnant woman, or what should be your blood pressure for it to cause an alarm? And to Dr. Akaba too, she said that when you get to the hospital, maybe with a severe headache, and they try to give you para, she's trying to empower us that we should seek for more care. So what will they do to you, or what's the next step they will take apart from the para for you to know that they are taking an advanced care of you because you have severe headache and not just the para, and they'll tell you that you'll be okay? Thank you.
Thank you, Hanifa. Dr. Shraf and Dr. Akaba, if you can answer the question, please.
Thank you so much for the question. My question is very straightforward. What is the normal blood pressure in pregnant women? And at which point are we going to be worried that, oh, our blood pressure is high? You realize that Dr. Kaba made reference to this earlier on. The normally pregnant women, if only the pregnant woman is normal and have normal blood pressure, their blood pressure is usually around 120/80, and then the highest you get is around 130/85 thereabout. And so, as the literature says, if your blood pressure gets to 140/90 or more, then you should be worried. It means that by definition, you have developed hypertension in pregnancy. If your blood pressure systolic, that's the one on the top, gets to 140 and the one at the down gets to 90 or above that, then by definition, you have developed hypertension in pregnancy. But let me also sound a warning that there are some people whose blood pressures may be lower than that, especially very young girls, whose blood pressures may be slightly lower than that, or maybe 110/85, but they may be developing preeclampsia. But because they are very young girls with very low blood pressures, even that fact that the blood pressure is around 130/85 may be that her blood pressure is on the way to go up. So when you go to the clinic, the midwife put all these factors into perspective. And then the midwives and the doctors put all these factors into perspective, and they will take the appropriate decision for you. Dr. Kaba will answer the second part, because that actually refers to what she said during the presentation.
Okay.
Okay, Dr. Kaba.
Okay, so thanks for the question. So, as a little clarification, I said that that's why I mentioned all the symptoms, and then you said yes. If you have headaches and you are pregnant, you have headaches, you go to any facility. So we are empowering you by this discussion that headaches could be. So you can have headaches that may not be even related to hypertension, but it's better for you to be careful and seek proper care than not to be. So that's the key word, is that headaches could be one of the signs and symptoms of hypertension and preeclampsia. So when you go, any pregnant woman, as per our standards, once you enter a facility for any care, blood pressure has to be checked. So it is important that you've entered, you have headache, then per this discussion, we said it could be hypertension, it could be preeclampsia. Immediately you get to the facility. If your blood pressure is not checked, humbly and respectfully, and as you go, don't go with the mindset that the healthcare workers don't know. No, they know their work, but just in case you don't receive the care, once you have it in your mind that it could be hypertension. And for us to define hypertension, you need to have your blood pressure at a certain level. So once you go in and your blood pressure is not checked, you go and complain, I'm pregnant, I have headaches, and your blood pressure has not been checked. Respectfully ask that, oh, please, I have learned that hypertension can cause headaches. So once you say that, you kind of gently insist that they check your blood pressure to make sure that you don't have hypertension. That is step one. So per this, I'm saying that if you have headaches or any of the symptoms, know at the back of your mind that it could be hypertension, it could be preeclampsia. So as you go to the facility, you expect that the first step is for them to check your blood pressure. So if it is not done, ensure that it has been done. And once it is done, you have to show an interest. If you respectfully ask somebody who takes your blood, oh, please, what is the blood pressure? The person will surely tell you. Communication is very important. If you even go to the bank and you shout at the bank teller would also probably respond in a very negative way. So it is very important that you communicate respectfully and nicely. If they check your blood pressure, you should find, oh, please, may I know what the blood pressure is? And just know that if once the blood pressure is 140/90 and above, it means that the headaches is likely to be coming from preeclampsia or hypertension. So once the health worker says, oh, just get maybe paracetamol, go home, then you can just respectfully say that, oh, you learned from some training series that no, it is hypertension. Once the blood pressure is above 140/90, so you would want that to be addressed for you. I hope this answers your question. So the first thing is to know that if you have headaches or you have any other of the symptoms we've talked about, just know that it could be hypertension. The word is could. In medicine, we say it's a differential diagnosis. Once you are pregnant, and because of the deaths that we have seen, the trouble that we have seen hypertension cause, if you have severe headaches, just know that it can't be, and it is possible. There's a high possibility that you have hypertension. So immediately you run to hospital. How do you confirm it's hypertension? Your blood pressure has to be checked. No health worker can look at your face and say, as I look at your face, I've seen a vision that it is hypertension. No way. For the person to be able to diagnose that, your blood pressure has to be checked, and it is something you have to see being done. So if it is not done for you, respectfully ask that it is done and show an interest, know what it is. So once it is 140/90 and above, you should know that this is hypertension or preeclampsia. So that if your management does not address, if the management says, oh, go home, you have take paracetamol, then you respectfully say that, no, I have learned something. If you are not satisfied, please go to another facility. It is very important, or even within the same facility, especially if you walk into a hospital like Ridge, everywhere you see, if you are not satisfied with service care, call this number. You have Ridge Hospital is a typical example of a place where it's boldly displayed that if you are not satisfied with anything, there are avenues that you can call and it will be addressed. So that is what I hope it answers your question.
Yes. Thank you, Dr. Akaba, for such a very elaborate answer. And so we have two more questions that we can take. The first one is from Lena. She says, talking about the liver, I think Dr. Shofenyo will answer this. Talking about the liver, please, I would like to know the right position for a pregnant woman to sleep that will not pressure the liver, leading to high blood pressure. Thank you. And then the second question is, please, is it advisable to induce labor in patient diagnosed with pregnancy-induced hypertension or pre-eclampsia? And then the final question will be, our antenatal clinics well resourced with skilled personnel to provide this education to our pregnant women, because some women who actually attend antenatal clinic have no knowledge of preeclampsia. I can testify to this being a survivor. My first pregnancy, I did attend antenatal at a private clinic. They did see the symptoms I told them, but up until I fitted and had eclampsia, I did not even know the word or the condition existed. So Dr. Shofenyo and Dr. Akaba, these are the last few questions that we are taking. Kindly answer accordingly. Thank you.
Thank you very much, our host, for those questions. The liver. The question is indicating which position do we have to do pregnant women have to sleep in so that they will not pressurize their liver to cause preeclampsia. You realize that we did not mention that preeclampsia is due to pressure on the liver. We didn't mention that. What we said was that preeclampsia probably is related to the formation of the placenta of the baby. You know, we said that it's a pregnancy-specific condition, and it's most likely related to the abnormal formation of the placenta. So there is no position you can sleep in that can prevent preeclampsia. Having said that, generally, for those who are in advanced pregnancy, we advise that most of the time, sleep on the left lateral side. Because when you sleep on the back, you are putting excessive pressure, or the womb, the heavy womb, puts so much pressure on the big vessels. And that can suffocate the baby in a way. So, and then also sometimes suffocate you yourself also in a way. But it is not to prevent. Lying on the left lateral side, the aim is not to prevent development of preeclampsia or hypertension, but the aim is to ensure that the blood flow through your system better, and then also blood flows to the uterus better for the baby to be well perfused. That is the first answer. I will leave the last question to Dr. Kaba. So let me take the second question. Is it advisable to induce labor in women who have preeclampsia? The question is, the answer to that question is yes and no. There are some level of preeclampsia that it is completely safe to induce a labor. It is not all the women that we take for cesarean section. It all depends on the circumstances surrounding the woman. So normally when we are making the decision to deliver the woman, first we make the decision that yes, at this point in time, we want to deliver the woman. Then the next stage, we also make a decision as to the best way to deliver the woman, taking the woman's condition, parameters. The blood pressure is one of the things we take into consideration. The woman's own state, how stable is the woman? How fast should the woman be delivered? If the woman has to be delivered in the next 2 or 3 hours, then obviously cesarean section is what has to be done. But if we see that the woman is stable and is fine for the next let's say 24 to 48 hours, then it means that we can induce the labor. We also take into consideration previous operations of the woman. If the woman has already have some kind of operations in the womb, let's say fibroid removal, mammectomy we call it, or cesarean sections, then it's likely we will take a decision in favor of performing cesarean section for such a woman. And then finally, if the baby is in immediate danger, let's say that is what we call fetal distress, or the water around the baby is so diminished that the labor is not safe for the baby, we'll also take a decision in favor of cesarean section. So by and large, all the doctors, most doctors and midwives, they know these conditions that I'm talking about. In all the labor wards, there are hierarchies, the midwives, the doctors, the specialists, and then the seniors. They all know the right decisions to take at the right time. The most important thing is for us to listen to the doctors and the midwives when they give us advice. You realize that I indicated one situation where even the patient insisted that she wants to deliver by herself. When the doctors haven't considered all the parameters, feel that the woman should be delivered by cesarean section because of the severity of the condition. The woman declined. And lo and behold, she developed abruption placenta, which is a severe complication, or which I also refer to as premature separation of the placenta. Eventually, the baby died, and she herself, her life is currently in the balance. She's in the intensive care unit. So these are some of the things. So the long and short, all these things are technical things. The long and short of it is that we should have a dialogue, a good dialogue with our doctors and our midwives. If the midwives or the doctor advises or counsel you for a particular mode of service and you don't quite understand, just ask the questions and then they will take their time to explain to you, you know, because no doctor is excessively interested in performing cesarean section because it is a cost and it's so much work. And so therefore, if you can deliver yourself, the doctor will allow you to deliver yourself. In the same way, no doctor is so overly interested in vaginal delivery. It also depends on your state. If the doctor feels that your current condition is such that you can deliver yourself, the BP is not too high, your condition is not too bad, the doctor will prepare you and induce the labor. Thank you very much. Over to you, Dr. Kaba, for the last question. ANC. That question is our ANCs well-resourced?
Okay,
With human resources, educated midwives and doctors, and equipments to protect the life of the women? That's the question.
Oh, okay. I thought the question was to give education. I thought she asked whether the NC was.
She said our antenatal clinics well resourced with skilled personnel to provide this education to our pregnant women, because some women actually attend antenatal clinics and yet have no knowledge of preeclampsia or eclampsia?
Yes, that's it.
Okay, so she was talking about education. So thanks for your question, and sorry about you not being given any information till you unfortunately developed the end stage, sort of. But in terms of human personnel, yes, the doctors, the midwives, the healthcare workers, in terms of technical knowledge, I must say that you cannot go through medical school or go through training in obs and gynae and not know about hypertension. In terms of nursing too, I'm sure you cannot go through. In terms of pregnancy, hemorrhage, that hemorrhage means bleeding. So bleeding and hypertension are two key things that every healthcare worker who, in terms of knowledge, should have, and I'm sure has. Now, as to whether we give that knowledge, we are supposed per the antenatal clinic. Antenatal clinic, when you look at the objectives of the antenatal clinic, it is one of the major objectives is to provide education on the danger signs. So how do we give this education? Two ways. When you come, or let's say three ways. When you come, the healthcare workers every morning, they actually give, especially in the government places, the healthcare workers, they give the information, like you would see a nurse kind of talking, addressing the whole, like the audience, all the clients waiting to be attended to. In the morning, they give a kind of lecture or some educative piece. That is one. And then your doctor or your midwife should be able to give you some information, especially you said it was your first pregnancy. The first pregnancy, as Dr. Schropp mentioned earlier, is a major risk factor for preeclampsia and hypertension. So your midwife and your doctor along the line should have warned you about these danger signs of hypertension. So these are all avenues. And then another avenue is the antenatal booklet. So you see systems. It is not just, it's like the Ghana Health System or the Ghana Health Service has tried several ways to give this education. So one, I said, the nurses they educate every morning, or one-on-one, especially in the private places where you don't have like, let's say nurses, you don't have clients who are sitting down together waiting to be seen. We expect that there's some one-on-one education by your nurse or your doctor on the danger signs. And then that's not another third avenue is the antenatal booklet. If you still have your old booklet, when you go, just look in it. The national booklet has all this information written there clearly as one of the ways in which the Ghana Health Service seeks to educate its clients. So these are all different avenues that are used for education. And now we are trying to improve on, even we have something we call quality improvement, which is something that is running through all the health system in Ghana, where we are educating. We even before you leave our facility, you are interviewed. Exit interview to find out if you have been told about all this. And how do I say it? We have pregnancy schools. So even all the private facilities, or most private facilities, as well as of the government facilities, they are all holding these pregnancy schools where they give purposely for education. So that is what I want to say. There are different avenues. One of the avenues is the antenatal booklet. It has all the danger signs clearly written there. They've even drawn some of the danger signs for people. If for those who cannot really read, at least they would see certain things. You would see probably a woman holding the head to signify headache. They've tried to educate you through the book as well. So I hope I've answered your question.
Yes, you have. Thank you very much, Dr. Akaba. And just to add to that, and that is the role of the organizers of this webinar too, Action on Preeclampsia Ghana, in partnership with the Sports Study, to actually provide that, to support the arms of the government and the Ghana Health Service to provide that education, to the healthcare workers, notably the clinicians, midwives, and actually also provide the basic education for patient survivors like we are doing today, which is why we are holding this webinar. So in addition to all that we receive at the facilities, you can also, inform your colleagues, your friends about this webinars, which because of COVID is being done virtual, but hopefully in 2021, in addition to it being virtual, we'll also do physical gathering, meetings, and education of that sort. So that comes to the end of our Q&A, our question and answers. At the beginning of the show, we showed a video, a survivor video, but it looks like there was a problem with the audio. So if you don't mind, we would like to briefly show that video, and then we'll bring this meeting to a conclusion.
But there's no fear. Come on. So she wants all together.
Okay, so I understand that the audio for the video is low. We will share the link through our chats so that you can watch the video after. But basically, that is my story. For those of you who don't know me, my name is Kwewa Biofuswapia. I'm the Executive Director of Action on Preeclampsia Ghana. I'm a 3-time survivor of preeclampsia, eclampsia, and HELLP syndrome. 4 conceptions, 3 dead babies, and I have only one surviving child. That is the reason and the passion and the inspiration behind these webinars, and we are grateful that you could join us. We want to remind participants, if you can kindly put on your video, we would want to take a group picture following this presentation and this meeting. So if you can kindly put on your videos, we'll be very grateful. Before then, let me go through some final slides. We've come to the end of our program. For those of you who were asking how you can support us, as you know, Action on Preeclampsia Ghana is an NGO. So if you would like to support us, we'll welcome every donation. We have that on the screen. We'll also share it afterwards. You can also sponsor, partner, and collaborate with us on any of our events, be it virtual or physical. You can also volunteer your time, your expertise. Dr. Shofenyo and Dr. Akaba here, as you can see, are volunteering their expert knowledge in their field to educate us on this condition. And you can equally also follow us on Facebook, Twitter, Instagram, like our page, comment, and share with your friends and family. We will also be sharing a link for a feedback form. If you can kindly tell us how the webinar went, what you liked about it, and if you were indeed educated. We also have our upcoming webinars between now and December. We have 2 more series for this patient learning session. So if your colleague or somebody couldn't participate today, you can inform them and they can participate on the one for 7th November. Actually, sorry, that's a wrong date. And then 5th December. Follow after. We also have coming up our Respectful Maternity Care series, where we are going to talk about the care that women receive during their stay at the hospital or during their outpatient services that they receive. And so the dates for these are 30th October, 13th November, 27th December. For this series, we'll also have the WHO representative sharing with us what the theoretical framework is when it comes to respectful maternity care. We come to the end of our webinar. I would like to thank our participants, yourself, but especially we would like to thank the organizing team whose names are displayed on the screen. They are great support. And especially we also like to thank the speakers, that is Dr. Shofenyo and Dr. Akaba. We couldn't have done it without you. It was a very educative program. And we also like to thank our partners, the Sport Study, that is the Severe Preeclampsia Adverse Outcome Triage. It's an ongoing study. If you would like to volunteer, be part of it, kindly email us. And also Greater Accra Regional Hospital. It's been a great journey having them as a partner. On this note, I will stop sharing the screen and then we will take the group picture accordingly. If you have any questions, kindly email us and kindly send a message. We will do that. So the picture is being taken. Please put your video on. Okay, thank you very much for doing that. On this note, we come to the end of our meeting. We look forward to seeing you for 7th November for the same thing. If you missed it, if you have a friend who missed it, you can always share the information. We'll be sharing the link for the feedback form. We'll also send email on the presentations. And if you want to support us in any way, also kindly contact us. Take care, stay blessed, stay safe. Remember, it's Breast Cancer Awareness Month. So as women, we've been encouraged to and empowered to take charge of our health. So please also get your breast checked so that we will not die under any circumstance, not during birth and not because of our breasts. Thank you very much. Take care. Bye. Dorothea, Dr. Schroff, thank you. I can't hear you.
Thank you, CEO. Thank you, Dr. Shaw.
Thank you all. Thank you all. Thank you all. That was a nice program.
Yes, it was.
It's really a great one.
Linda, let me see your face.
Yes, my boss.
Let me see your face for coming late.
I think you have to put everyone in the waiting room back, then we can talk.
Yes.
Hmm? Yeah.
I'm ending the meeting now for everyone. Team, we can have a post discussion on our WhatsApp platform. Thank you once again for your time.
Thank you.
Okay, thank you.